Everyone ready? Good morning, everyone. I'd like to call this Board of Supervisor meeting to order. The date is December 7th. The time is 9:02 a.m. I'm going to ask you to please stand. I'm going to ask Walt Ward, our Water Resource Manager for Stanislaus County, to lead us in the pledge, and then remain standing for an invocation from Pastor Jeffrey Woods from First Christian Church.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Please join me in a word of prayer. Heavenly Father, on this Pearl Harbor Day, and as we approach the longest night of winter in 2 weeks, we thank you for the reminder that the darker the night, the more brightly even the smallest light shines. So as we begin this important time of deliberations this morning, we thank you for the many signs of light that we're reminded of in our meeting this morning. The Pledge of Allegiance we've just spoken shines a light on and reminds us of the ideals upon which our country was founded and the light we are called to be. The presentations we will soon witness shine a light on efforts to prevent the darkness of drug addiction from engulfing our community, and on the hope of freedom for those who are currently living in its shadows. Even amid the details of reports and business items on the consent calendar, we see points of light like times of celebration, grants that have been made available, and donations that have been received. And these all encourage us as we seek to move forward. With these and many other sources of hope and encouragement in mind, I would ask this morning that you would provide each of our leaders gathered here with the light they need to see and clearly understand what is involved in each issue that is brought to them this morning, that they might make wise decisions on behalf of us all. While we sense the darkness around us, would you open our eyes so we can see, and would you light the path ahead of us for the good of every member of our wider community? For I ask all of these things in the name of Jesus, whose light I am always grateful for. Amen.
Amen.
As always, thank you very much, Pastor. And Walt, thank you. All right, we'll move on to item 3, which is a presentation of Red Ribbon Week photos and poster contest winners. Ricky Bispo and Adriana Taylor from the Stanislaus County Office of Education will be presenting. Welcome.
Good morning, Chairman Chiesa and Honorable Board of Supervisors. My name is Adriana Taylor, and I am here today with my colleagues, Ricky Bispo, Elizabeth Escalante, and Charmaine Monte. You will hear from Ricky in just a few minutes. He will be announcing and congratulating the winners. We are from the Stanislaus County Office of Education, Prevention Programs Department, and here to announce the winners of Red Ribbon Week photo and poster contest. Before we begin, we would like to express our utmost gratitude to the Stanislaus County Board of Supervisors for the opportunity to make these announcements and to highlight our winners in these esteemed chambers. Thank you for your continued support. It is greatly appreciated. Red Ribbon Week is a national awareness campaign in honor of DEA agent Enrique Camarena and to raise awareness of the destruction caused by drugs in America. Typically, the week is observed in the month of October on school campuses via dress-up days, rallies, community presentations, and the annual Best Decorated and Most Spirited School contest. In normal years, students, school staff, parents, and community members all work together to ensure a successful week. This year, as like last year, due to the limitations associated with the pandemic, Stanislaus County students were invited to participate in the Red Ribbon photo and poster contest. This contest was designed to be more conducive to our current reality, allowing for individual work and eliminating the need for gathering on school campuses. If you look at the monitors right now, you will see that for this purposes, we created a website which houses all of the information, rules, guidelines that students can review. Students went here to submit entries for the contest and to know how to enter the contest. The contest has concluded and the entries are housed at this site. Entries will remain on the contest website through December 22nd, at which point we will go ahead and take them down. Winning entrants are featured here toward the top of the page. With regard to contest numbers, we received more than 254 photos and posters submissions, and by the means of public voting process, received more than 262 votes. We ended up with a total of 16 winners. And without further ado, Ricky will be presenting the winners.
Thank you, Adriana, and thank you to Chairman Chiesa and to the Board of Supervisors. We're here today to honor the winners of the Stanislaus County photo and poster contest. Each of them not only met the guidelines, but also received the most votes in their categories. And the winners are, beginning with the elementary photo category, we have first place Ronald Manalo, La Rosa Elementary School. Second place Elizabeth Carez, Osborne Dual Immersion Academy. Third place Bristol McNamee, Magnolia Elementary. And then middle school junior high photo category, we had first place Desiree Meister from Turlock Junior High School. Second place Neva Perez from Patricia K. Beaver Leadership Magnet School. And then we had a tie for third place. So tied for third place we had Aiden Day from Turlock Junior High School. And also tied for third, Elias Sanchez from Cardozo Middle School. And then moving on, we didn't actually receive any submissions this year for the high school photo category, but moving to elementary poster category, we had first place Lily Lewis from Virginia Parks Elementary. Second place Alonso Martinez from Riverbank Language Academy. Third place we had Evelyn Espino from Virginia Parks Elementary. Moving to middle school junior high poster category, we had first place Vanessa Vasquez from Spratling Middle School. Second place Natalia Campos from Cesar Chavez Junior High School. And then third place we had Santiago Yael Anaya Plata from Turlock Junior High School. And then last but not least, we had high school poster category. Winners there, first place Sienna Crawford from Houston High. Second place Alexi Pulido from John Pittman High School. And then third place Taylor Clausen from Houston High School. So congratulations to our winners. And thanks to a generous donation from our amazing community partner, Sutter Health, our winners received gift cards from various vendors such as Amazon, GameStop, Starbucks, and others. The prizes were $100 for first place, $75 for second place, and $50 for third place. Winners also receive a congratulatory postcard from the Stanislaus County Office of Education, as well as participation certificates from local legislators, including the Stanislaus County Board of Supervisors. Thank you for those. Assemblymember Adam Gray's office, and also State Representative Josh Harder's office. Additionally, all students who submitted an entry in the contest will receive a $5 gift card just for participating. And then a big thanks to all the adults also who assisted with gathering art supplies, understanding the contest guidelines, and submitting the entries. We appreciate everyone's participation, and again, the support of the Stanislaus County Board of Supervisors in bringing attention to such an important topic. Thank you. Red Ribbon Week is more than about simply preventing tobacco, alcohol, and other drug abuse. It's also about the importance of living a healthy lifestyle. People who live healthy lives tend to be happier, more satisfied, and have a more positive effect in our community. Thank you again for your time, and we wish everyone a great and happy holiday season. Thank you.
So from the board, we missed the kids.
Oh, yeah.
Having the kids here, it adds a different vibe around here that we don't have very often. And so we look forward to getting back to times when we can do that. That's number one. Number two, I have to tell my other board members that the vast majority were from District 2, as is always the case. And so it must be me going to the schools. But I truly appreciate kids doing it. Ricky, what you just said, your last 1 minute of speaking about living healthier lifestyles, and we have issues in our community. We don't ever say that we don't. But if it wasn't for programs like Red Ribbon Week, where we try and catch kids early and teach them that it's not necessarily the path they should be going down, right? It makes a difference. And so it's long-term care. That's the way I look at it. So thank you very much for coming in.
Thank you so much.
Thank you.
Okay, we're going to move on to item 4. It's an update related to the 2019 novel coronavirus COVID-19 emergency and essential services. And I'll turn it over to Jody Hayes.
Good morning, Chairman Chiesa, members of the board, and as always, all members of the public. Thank you for joining us this morning. I'm going to kick us off with just one particular topic before our public health team gets into the rest of today's presentation, and I want to invite Sheriff Dirksey down to help me with this particular topic. So I wanted the board to know, as well as the public, that at the outset of the pandemic, we did declare a local health emergency as well as a local emergency. So we have 2 emergency orders in place that have been ratified by the Board of Supervisors. I wanted to acknowledge that last summer, when we had a significant decrease in COVID cases prior to the 3rd surge, we'd actually evaluated whether or not those emergency orders should remain in place and what are the actual technical impacts in our community to no longer have them in place. So I wanted you to know, now that we have had some reduction in cases again, we're revisiting that conversation, and Sheriff Dirksey will update you on where we're at with that, as well as the members of our team. Thank you.
Thanks, Mr. Hayes, and good morning, Chairman, members of the board, and Mr. Bose. About 2 weeks ago, we started engaging in this conversation again as we saw our numbers begin to decline about and the question is simply, do we need to continue with a state of emergency or a declaration of emergency? And I do want to draw a distinction that we are looking at the difference between a state of emergency versus a public health emergency. They are not mutually inclusive. We could continue with a public health emergency without operating under the state of emergency. And a lot of our discussion has been around simply, do we need the state of emergency, and if so, why? And our intention moving forward is that if we cannot answer definitively to this board and to our community why we need a state of emergency, we are going to most likely recommend that the county end the state of emergency. I'm going to defer to Dr. V in the future as far as we move forward regarding the public health emergency aspect of it, because that falls solely under her purview. But as we look across our state and across our nation regarding the state of emergency, there is some concern that perpetually operating in this manner is counterproductive. As we start to use a term like endemic regarding COVID, that would imply that it's going to be here potentially forever, and that is no longer an emergency. That is something that we need to operate within our normal policies, procedures, our normal democratic and legislative type of processes. So that is everything that we are evaluating moving forward. There are some concerns regarding various medical authorities that if we do stop the state of emergency, specifically regarding hospitals and some of their ability to flex certain ways with staff and so on. But that also may be covered under the state's guidelines. But it is a fairly complex issue, and so it's not something that we simply can do or undo all at once. but our expectation would be that in January, after the new year, we will come back with a recommendation to the board.
Thank you.
Thanks, Sheriff.
Okay, I think we'll go ahead and turn it over to our team. Thank you.
All right, good morning, everyone. Starting off with our testings, hospitalizations, and deaths, our data there. As we look at our cases, what you can see our surges, and most recently the one we just went through, summer to fall of 2021. You can see it's unfortunately a bit difficult to interpret yet. We know over the holidays people don't test. You can see the little white decrease in the middle of that this bar graph with the blue showing our confirmed cases. So we're still waiting to see what it looks like going on, but right now I can't say that we've seen any decrease or anything. We just see a good, stable, at least stable cases that we're seeing in this county that have been reported to us. So, not increasing, which is great. I know some other counties have seen that, but we have not yet seen that here. Still there? Okay. So then as we look at our daily case rate, you can see that here, this is our 7-day average with 7-day lag, and you can see that we've come down, and as of yesterday, it was 11.7. So it's still a good trend. You can see just a little bit of a tail at the end, but we'll see. We'll just continue to watch and see how that goes. And then our testing positivity down in the 5%, which is really nice to see. So again, not seeing an increase there. Our test volume, I do have to point out, did fall a bit. As you know, we were in the 400s, up 399, 450 area. Of course, with losing a day of testing and the decreased testing over the Thanksgiving holiday, you are seeing a decrease in that volume, but that will pick back up more likely. I think we were pretty stable somewhere in the 300s per 100,000 per day. As we look at our total hospitalizations in the orange and the ICU in the red, you can see, again, we've stayed nicely low, really. We had about 80 in the hospital yesterday, and the ICU numbers, again, staying pretty stable. So that's a very good indicator, because even when our testing decreases with a holiday, hospitalizations are a very constant indicator. So that's what we see. So, as we're looking to the future and looking to see what happens, I'm sure everybody sees the news of what's going on in Europe and how they're in a pretty good surge, and that is Delta. So we're going to talk a little bit about another variant later, but we just continue to watch and see what happens in this county. I wanted to start talking a little bit more about treatments. So there's this new, possibly coming treatment for mild COVID called molnupiravir. It's from drug company Merck. And then it's an oral antiviral. It would be twice a day for 5 days. What they've shown finally is about a 30% reduction in severe disease for those who take this antiviral. The FDA Advisory Committee met on November 30 and did recommend authorizing this medication. We are still waiting for FDA action. Looking at what the studies was done is expected if it gets authorized to be for people at risk for severe disease. The study was people with at least one risk factor for severe disease. We have been working for a couple weeks ensuring that if approved or authorized, that this medication will be distributed out to every county in California. So working on a distribution system still with the state. It will be distributed to pharmacies, of course, because this is a medication to be dispensed by pharmacies. So as we look at this, the treatments we currently have available, what we see are, comparing this in a side-by-side table, what we see, we have what is currently FDA authorized. There are some monoclonal antibodies. You can see the range there. There's 3 different ones we can use for people with mild to moderate COVID-19. Molnupiravir, they're 30% versus the 70 to 85% of the monoclonal antibodies. For the timing for the monoclonal antibodies, it's up to 10 days after symptom onset. Molnupiravir, the study was done within 5 days. The recommended was within 5 days. But again, we don't have FDA authorization yet, so we don't know how that will actually come out. The route is either IV or subcutaneous, so injections for the monoclonal antibodies, and it's oral pills for the molnupiravir. The frequency, you can see the monoclonal antibodies, it's one time, but it does take some time because there's an hour monitoring period after the either IV infusion or the injection. And then for the molnupiravir, again, twice daily for 5 days. And then both of them are really for people at high risk for severe disease. We're just assuming if molnupiravir gets authorized, that's the way it will look. So again, this is treatment for disease. What we are preparing the messaging for is to go out again to healthcare providers, because it is going to be a medical decision making with the healthcare provider and the patient to determine which treatment is the best for them, and either write their prescription or refer them for monoclonal antibody treatment if they do not offer it themselves. Okay, so Omicron has been a lot in the news the last week and a half, I think it's been, and so I will give the update as I knew it as of yesterday. So this is a variant that was first really reported to the World Health Organization right around Thanksgiving, and this came from, was reported by South Africa. I don't say it came from there, but that's where the first report came from. And what you can see is this is what we're looking at with what South Africa has seen. So they have had a lot of beta, which really never took off in this country. And then in their winter, which is our summer, they had the Delta surge, just pretty much like everyone else. And you can see that pretty much took over beta there. What they saw was an increase in cases, and so when they looked at it, what they found was this new variant called Omicron. And we're going to talk more about what this involves, but as they've looked at it and they've been monitoring their spread, what they found was this was first identified in this province of Gauteng, which is including Johannesburg. And so you can see that they're the red line when they graph their cases by province, and this is as of December 4. So what you can see is in the red is this province, and they had a big peak of Delta, you can see, in their winter. And what you can see is a pretty rapid increase in cases that has happened recently with the emergence of this new variant. So we can't make any causation about this data. I'm just showing you that why people are really looking at this variant very closely is because of what we've seen going on in places such as South Africa. So what do we know about this variant? Well, one of the things that we wanted to talk about, and I wanted to bring us back to this slide that I probably haven't talked about too much for the last year. So this is a coronavirus, I think you can see with its spike proteins sticking out, and the spike proteins at the end of those spike proteins have that turquoise area, and that's the receptor binding area. Binds to the ACE2 receptor on the cell, which you can see at the bottom of yellow, and then the cell takes in the virus, and that's how a cell infects you. So as we look at the changes, the concerning changes in Omicron, they have a lot of changes in their formation of their spike protein. So, and there's at least, I think there's 52, the last I heard, different changes in their spike protein. And then when you look at that receptor binding area, which is responsible for it infecting a cell, there's over 30 changes in just that area. So it really seems to be concentrated in that receptor binding area. So some of these are theoretical concerns, but it has to be looked into. So some of these changes we know about, like some of them are the same as with alpha or with beta, but some of them, they don't really know what they do. And so really looking into how this will affect it. So a lot of theoretical concerns at this time, but without more information, hard to say what the practical concerns are. So as we talk about this variant and what we can do about this, I brought back these slides that I had shown when the vaccine came out so everybody understood how the vaccine worked. So pull these back out. So you can see the coronavirus binding to the ACE2 receptor by its spike protein, getting engulfed and entering the cell, releasing its messenger RNA. So when you get, say, a messenger RNA vaccine, it just takes in that messenger RNA and then it starts this same process pretty much from there. So the RNA, it uses the cell's mechanisms, right? They don't reproduce by themselves. They need to use your own cell's reproductive ability to regenerate itself, to make more messenger RNA, to make more, to make the proteins it needs to reassemble all these new viruses, and then they get released from the cell to go on and infect more cells. And so as they get released, which is just the spike protein in the case of the vaccine, They're picked up by this antigen-presenting cell. You can see it presents those spike proteins, what you want to have the antibody made to, what it knows it needs to present for the body to develop its immune response. Takes its T helper cells and works with B cells, which make your antibodies, with T cells, which are the ones that after the antibody binds to the foreign body, it goes in and kills. So they're called your cytotoxic. So they're getting rid of the infection. And then these, and this is important because we're going to keep talking about this, that you get these memory B and T cells that can come back. And so when you see the same, when your body sees that same antigen again, like the spike protein, it can mount an immune response and come and destroy the virus so you don't get severely ill. There's some difference between B and T cells. So the one thing we can measure, right, is antibodies. And so we talk a lot about antibodies and waning antibodies and stuff. The T cell part of this immune response, which we keep saying antibodies aren't the whole thing, the T cell part of this is very, very difficult to measure. But it's extremely important because this is what really prevents you from severe disease. So, and as we look at this, you know, when variants form with differences in the spike protein, how much of the difference does that make in the way your antibody response is to it? So we have a great, incredible immune system that gets wide variety of immunity. It basically looks at it and says, okay, how many different ways can this change? Our immune system is very well trained to understand that things change. And so it develops broad immunity to many different variations of the antigen at which it's seeing. So I hope this is being clear because this really comes into play when you're looking at how the antigen changes and how repeated exposure to this can really help boost your immune system and say, okay, well, this is a little bit different. I'll get a little bit more specific to this one, but also broaden everything else. So I hope this kind of explains it as we go through. I hope it helps to understand. It's frozen. It won't advance. Oh. Sorry. Okay, back to working. Sorry about that. So what are the things that the questions about this virus and how does what we know help us to come up with some answers? So is this more transmissible? Is it going to spread more easily? It's really unknown if it'll spread more easily compared to Delta. Some preliminary evidence seems to suggest that it does spread more easily, but really, you know, a lot of times what we see at the first isn't the way things pan out. So we really just need more information to say that it does. I think people are pretty convinced that it spreads more easily than the initial virus, which, remember, Delta is about, 3 times more easily spread. Does it spread more easily than Delta, and if so, how much? Those are questions that still need to be answered. Is it more severe? Again, it's unknown and it needs more information, but there certainly is no early evidence to suggest that there's an increase in severe disease. In fact, it's been quite the opposite. It looks like it's been milder, but you have to be very careful with that interpretation, because the people it's been seen at are well travelers who are well enough to get on a plane, who are in general fully vaccinated when they come to the United States, as well as a younger population. It was like a college outbreak, a university outbreak, where this was first identified. So it's been a quite young population so far. So it's difficult to say what this will look like in the entirety of the population. And then the immune evasion, which has gotten a lot of play as well. So vaccines are still expected to continue to protect against severe disease. That's that T cell immune response. So we expect it. Boosters will increase the level of your antibodies and may offer better protection against breakthrough infection. That's certainly happened. One of the questions I've gotten is, why don't we do a booster to different variants? They actually tried one in trial, which I think was with Beta. They used it in a trial with Pfizer to see if you had better antibodies, and you didn't. Giving the same one or giving a different variant did not change the level of response of your antibodies. The antibodies really work to stop that initial infection and stop it where it is, so getting a booster gets your antibody level back up to where it is after, the acute need to respond to that antigen being presented to your immune system. And then some monoclonal antibody treatments may be less effective. That's being evaluated. Doesn't mean we'll lose all of them. There's definitely one that's of concern, specifically the bamlanivimab, the atezolizumab, which we call BAM-EDI because it's too long to say it the other way. That one, there's the same mutation in this Omicron virus that was in some previous variants, like beta and alpha, that made this monoclonal antibody less effective. So it's expected to be less effective, but we still have a couple others that are in our toolbox. So less effective means what? And that has to be really defined as well. Does that mean it goes from 70% to 50%, or does it mean something else? So really what we're looking at is there's still a lot of information that we need to have to be able to really understand what this variant means. CDC and other countries are looking at how this virus acts. They've sent teams out to where new cases have been described in the United States and are really working to understand the spread, the severity, and really gather systematic data, not the anecdotes that we're talking about, to better understand this variant. And they have estimated about 2 to 3 weeks for meaningful data. And so, there's a lot of people, and it seems to have caused a huge uproar and to cause panic in some people, but I have to tell you, this is not a reason to panic. We have plenty of tools, I think, in our toolbox. We certainly want more. We are not back to where we were with having our immune system not ever having seen this type of coronavirus. We certainly have some level of immunity for most of us to protect us. And especially with our vaccination, we know we can get a booster and get our antibody level back up to really prevent infections and stop spread. But there are things you can do, right? We can get back to our basics. First of all, this is back to our basics. It's a respiratory virus. It's transmitted person to person through the air. It doesn't matter what variant it is. Those basics are always going to be true. It's person to person through the air, much less getting it on your hands and putting it in your eyes, nose, and mouth. That hasn't come to be a big part of this transmission. So how can you protect yourself? Well, and another thing is, right now, our threat is Delta. What we have circulating here in California, mostly in the United States, mostly in Stanislaus County, is Delta. So the best way to protect yourself and the safest way to develop immunity from diseases, including COVID-19, is to get vaccinated. Get boosted because, again, as we talked, it raises your antibody level to prevent infection. Nobody has the antibody levels as high as when you're first either infected or vaccinated. So you want those antibody levels back up. Higher antibodies can overcome weaker binding. So if these antibodies are binding more weakly because of the changes in the spike protein, especially that receptor binding area, getting a higher level can overcome that. They changed the recommendations for the boosters just a little bit. Because they had all these shoulds and mays, and right now it's should. So all adults 18 years and older should get a booster 6 months after your second shot of either a Pfizer, also known as Comirnaty, or Moderna, or 2 months after your Johnson & Johnson to really get your antibodies levels up. Again, person to person through the air. This is a respiratory virus that you breathe in to become infected. So, the way you do that is to try to breathe in a whole bunch less virus. If, get antibodies to protect yourself for when you do breathe it in, or T cells too, and, try to limit the amount you breathe in. Work on the ventilation, open the windows if you're in different places, move activities outside. It's easy because you dilute the air then and breathe in less virus. Staying home when sick removes sources of virus from the community where they can spread. Covering coughs and sneezes also decreases the virus in the air. Wash hands thoroughly and often. Wearing a mask decreases the amount of virus someone breathes out and decreases the amount of virus someone breathes in. And then avoiding crowds because it just increases your likelihood that someone in there is going to be breathing out a virus that you have a possibility of breathing in. Testing, more frequent testing. If you're concerned about gathering with loved ones over Christmas, we don't say don't gather. We say maybe if you're concerned about it, add another layer of protection. Testing before you gather to ensure that it's safe for your 90-year-old mother to come. This will help you protect your family and friends. It also helps us track the spread of any variant and the emergence of any variants. And then if you do test positive, talk to your healthcare provider about treatment. We have monoclonal antibodies. We soon may have an antiviral, an oral medication you can pick up from the pharmacy. Support your physical and mental well-being with being healthy. Active living, healthy eating, eat your fruits and vegetables always helps. And finally, another respiratory virus that circulates now that we have a vaccine for is influenza, so it's really time to get your flu shot to protect you from that. There are other respiratory viruses that are around, RSV, parainfluenza, there's a whole bunches of them. We don't have vaccines for that, but all the other things work. And then again, this is the time of year we know that the cold and the gathering indoors, because we're not outdoors as much, this is when respiratory viruses thrive and spread. This is also time, it's a great time of year when we get to gather with our family, our loved ones. So if you're concerned about the risk to yourself, to your family members, consider adding another layer of protection to protect yourself and to protect your loved ones. Thank you, and I'm going to turn it over to Mary Ann.
Thank you. I'm just going to give a brief update. With regard to vaccination, we've updated the
Oh, I'm sorry.
That's okay. The doses administered per day in the county, you can see it started to go down. It's gone up a little bit. That dip is right around Thanksgiving. But we are seeing a lot of doses being administered every day. Some of those are first doses. Many are booster doses. Here we've updated the percentage of partially and fully vaccinated. It's still going up, but at a slower pace. But want to keep bringing that to you to see where we are in our community. And I imagine that some curiosity about, well, how are the boosters going? What's the uptake? And we are seeing, definitely seeing boosters, demand for boosters. This slide says third dose, and this really encompasses the additional dose for those that were immunocompromised, may not have built, plus the booster. And I believe it also is counting the Johnson & Johnson. It's really those that have already had the single or the full series. So we'll just want you to know we're continuing to monitor that because we know that's a part of our mitigation strategy to try to protect the community. Okay, and then I included this. There was a comment before about a statistic that we'd shared a few weeks ago. So the previously shared stat showed that the cases since January 1 of those not vaccinated, and it was at 90%. You've already seen that figure. So we went back and looked at the numbers from July 1, thinking that was a good point in time when really most adults, there was ample access to vaccine. There had been enough time to become fully vaccinated. So, and it really doesn't change the picture too much for our community. That 85.5% of the cases since July 1 indicate those were non-fully vaccinated individuals. And unfortunately, since July 1, we've lost 342 individuals, and that's 90.6% of the deaths were in those that were not fully vaccinated. This helps to continue to explain why it's a priority for us in terms of the element of prevention. There's continuing interest with regard to immunity from infection or from vaccination, and this is a slide that we've brought before. In terms of looking at it today, there are a lot of different studies that have gone on, that are still going on. If you look on the CDC website, there's they show studies that some will show that it's about equal to vaccine, another study will show that it's not. So I think where we are right now in terms of the science informing us is that we really still just don't know enough about the level of immunity that one gets from infection. We know a lot more about the effectiveness of vaccination, and some of that is probably because there is more study on vaccine. They're manufacturers. There's a business model there, so there's probably more evidence with regard to vaccine. What we see so far in these varying studies on immunity from infection is that as Dr. Villa said before, we don't really know what the level is that you need for good protection. So whether you've built antibodies, have you built enough? What some of these studies are showing is that it's inconsistent in terms of the level of antibodies, the level of immunity gained from infection. It appears that if you have a more severe case, you've probably gained a higher level of protection. If you're younger, you've probably gained a higher level of protection compared to if you're older. But again, at this point, from what we've monitored, that certainly it's not studying that we do at a local level, but based on what we've looked at, I think in terms of giving a hard statistic, it's still being studied. So just so that you're aware, and based on what we know, we would still say that that vaccination is the safer way to gain immunity. And we know more about that, and we know that we know the level of safety compared to what we've seen in terms of getting COVID. So I hope that explains a little bit more too. And so we're always going to keep this in front of the community. If you haven't gotten vaccinated yet, or you want to get a booster, this is a really easy way. Go to the My Turn website. It's really user-friendly for those that may not have access. We've got phone numbers there too to call, and we'll help you get an appointment. I did want to share with the board that that over many months we have made good effort to ensure that anyone who was homebound, we didn't want that to be a barrier, and so we've done homebound vaccines. We've been reaching out to those individuals to find out if they need a booster, and doing that too. So just wanted you to know that we've been doing that too. And then this is just for those that are looking for more information. Want to make sure they know how to get to us and our website, and then the information and the links that we include to other sources as well. And with that, I'll stop and try to answer any questions you have.
One quick question for Dr. V. I know you can mix and match your boosters.
Yes.
But is it still smartest just to stick with your current, or is there any evidence either way?
It's so interesting. Recently, a couple studies came out that they thought mix and match actually looked pretty good. It's hard to say. You can take any one you want. There's no proof when they've looked that any one is better than the other. The most people I've talked to, and including myself, I just stuck with my same one because I knew what to expect. So rather than switching and maybe having something you didn't know to expect. So I expected a sore arm and feeling a little bit lousy, and that's what I got. So it felt good to stick with what I had. But yeah, so I have no data to tell you that any one is better than any other.
Perfect. Any questions?
If I could, thank you guys again for the presentation. So just looking at the sheet that talks about the monoclonal antibodies and the
Molnupiravir.
Yeah.
Named after Thor's hammer, just so you know.
Okay. So I guess a couple things. It's nice to see this in here, first of all. I appreciate that we have this in here. And when we look at the 70 to 85% reduction in hospitalizations, I know we've been talking about that for months. It's nice to actually see you guys putting that in a presentation here. How are we doing as far as promoting with the physicians the monoclonal antibody treatment? How's that going?
We have provided the information to the physicians through a standard means. We do health alerts, and so we've done that. We've reached out to the hospitals and asking them about whether they think that their medical staff are well informed, and we've gotten a thumbs up. We are planning. We're waiting every day on this, on what the FDA is going to do with the oral antiviral, and already have begun to put together another piece that's going to go out to the providers, again with more monoclonal antibody information. So as soon as that could be today, it could be tomorrow. We don't know, but that's planned as another way to get out in front of the providers. And we do know that there's been one more provider since I last spoke that's in the process of of becoming a monoclonal antibody treatment site.
Okay, and I know you gave that list last time we were here, Mary Ann. That's posted on our website, that list? Do we have that on our website?
It is. There's if you go to the guidance section on our website, there's a section on monoclonal antibodies. It
And
gives
all of those
information about it.
locations.
It gives that website. I checked it yesterday. It gives that website that is a national website of infusion sites.
Okay, and so it shows all of them here in our county.
It does, but like the one I said is just coming on. I don't know that that's done yet, but that's the intent. Yes.
Okay, so it's not up yet as far as the locations in our county?
No. The website is up. I just can't tell you that 100% of our locations.
Oh, okay, perfect.
I'll check that, but I know some are. The last time I
Okay.
looked at it, yes.
And I can't help but think when I look at, we talk about this, and I know it's great, we push the vaccine, we've been doing that all along, that's great. But for those that won't get the vaccine, when I look at the deaths that we talk about here, the 310 deaths since July 1, I think, that were unvaccinated or not fully vaccinated, and then I look at 70, 85% reduction in hospitalizations, which I assume means reduction in deaths if they're not being hospitalized with the monoclonal antibody treatment. I wonder how many of those 310 deaths were administered monoclonal antibodies. I'm going to assume none of them. It'd be nice to know that. I mean, that's two. If you do the math, if those people, if we're talking about up to 85% reduction in deaths, and that's what this is all about, right? Keeping people out of hospitals, keeping them alive. That's our goal. It's always been our goal. If we had people administered these monoclonal antibodies, those 310, 264 of them could be alive right now, in theory, right? And looking at these numbers here. So I just can't fathom why, and not just here, but across the country, why we are not promoting this treatment. People would be alive today if they would have had physicians that, and tell me I'm wrong, I guess, here, what I'm missing here. It just doesn't make sense that it's taken this long for us to get to this point to finally start to promote this stuff. And I don't understand why. And I'm not blaming you guys for this, but I'm just saying across this country, I just don't understand.
Well, we are. I mean, you know that we are promoting.
We are
this,
now.
right?
Right, but we haven't been doing that for the first 15 months of this outbreak. And
But remember, like a whole lot of COVID, that also evolved. It's in some ways it's easier for providers than it was initially.
Sure, no,
So-
and I know we learned a lot, but I just think, and again, there's nothing we can do about it now, but I just think the more that we can promote this, and I know now we've got this other pill that's going to come out, 30% may be effective, I just think we got to do all we can to continue to put, this will keep people alive, keep them out of hospitals, keep them alive, which is our goal. So anyway, that's just, again, my commentary. I appreciate all the work you guys are doing.
And there may be another oral antiviral coming down the line that maybe will have better effectiveness too. So we
Yeah, no, that's great, but in the meantime,
keep adding our tools.
yeah,
Yep.
yeah, in the meantime, I guess we've got to promote this all we
Yes.
can. Thank you.
Supervisor Condit?
Dr. V. Marianne, thank you for your report. I'm looking at the immunity slide, and it goes into getting COVID-19, the risk of long COVID with long-term health effects. Could you kind of go into what long COVID is? And even with, let's say, if you are vaccinated and you have a breakthrough case, do you still have that threat of long COVID with that breakthrough case?
Sure. I'll start. Again, like everything in this pandemic, not everything is known. So long COVID is defined as having symptoms more than, it's weeks after your initial recovery. I think it's 6, but I'd have to look it back up. And so there's been a study looking at it, looking at the fact that somewhere between 30 and 50% of people still have symptoms, and sometimes it goes out as long as 6 months. And so there are people that still have shortness of breath, difficulty climbing stairs. There are people who still are very, very tired. So there's a lot of symptoms that linger for a long time. That's what long COVID is talked about. They're trying to define what causes it, how it's related to it, what we can do about it. So the incidence of having some long time fatigue, shortness of breath is pretty high. It's much less with vaccines, so less than 10% is the number I've seen. But you still can get it, yes, but it's less. Some interesting information is that if you have it, and they've looked at it, if you also get vaccinated, it clears faster. So it almost makes it sound like it's some something that needs your immune system boosted. But again, it's what causes it and how to best treat it is not known. But there is a pretty good association with feeling run down, tired, short of breath for weeks and weeks and weeks after you recover from your acute illness. And that's what long COVID is.
Thank you.
Supervisor Graywall, did you?
It was just a quick follow-up question. I haven't been able to check the website since last week, but what's the total amount of people that are providing monoclonal antibodies in the region? I'm sorry to put you on
I'm
the
going to
spot.
say 9, but I have to check. I have to check, I'm sorry.
And then the process, you were talking about one's in the process. How involved is that process? Is it just working with the county? Is it state approval? What can you just kind of walk the timeline of a process if we were to Supervisor Wither's promote it and had people and wanted to bring more people online to provide that service? What's the timeline to get more people signed up or approved, I
I'm
guess?
going to say about 2 weeks. I'll have to.
So it's not
yeah,
very
it's-
extravagant. I mean,
No,
2
and
weeks is pretty.
it runs through the Mohawk process, which is because that's the way that the supply is being allocated is through because it's still considered in short supply, even though we've been okay with our orders against that allocation. So it's a matter of getting registered and signed up. And I don't know whether in that 2 weeks they're already up on that website. I don't know, but I'll get more detail for you on that.
On the supply, that just, again, I'm just having conversation as we carry the conversation. Is supply from the 9 providers that we do currently have, is that a concern, or are we abundantly, well managed on supply, or is it a challenge every week? Is it like how we were originally getting our vaccinations when, it was just a trickle down, and now, there's, obviously an abundance of it. How is that with the monoclonal antibodies?
That's a good question right now, and let me explain, because I'm not sure the answer, but let me explain why. The allocation system has just moved from a weekly allocation to every 2 weeks, and so because of that, in our Mohawk process, working with providers, we've let the providers know that, and because of that, they've increased their order, so we went to the full. We've ordered now this time the full allocation. I think that that's just that's trying to ensure that we don't run out before that next opportunity. So I think over the course of the next 2 weeks, I'll be able to better answer if is the allocation sufficient or not. It has been so far. That's also going to be about what the trend is. If cases start to increase, there's going to be more demand. So some of that is uncertain. So I hope you understand why I can't answer that any better until we see how that, because of that change that just happened.
No, I appreciate it. And some of those things I'll maybe carry a conversation offline just to get more clarity on some of the things. But my main concern was how many. So if there is an option, I think we have multiple options to get vaccinated, and how close aligned is that with getting this treatment? Is it 15 locations in the county? You're saying 9, and in the process, if we do start seeing cases going up and more people want them, how fast it is to get more providers? And then supply obviously is our number one challenge to make sure we have enough supply for everybody. So thank you.
Other questions? Other questions? I know I always tell you privately, but publicly, I appreciate all you do. This is one of the most complicated things. It changes all the time, and again, on behalf of the board, we really appreciate everything you do. Tell your employees, I know they've been working hard now for closing in on 2 years, so make sure you pass that on from the board. Thank you. Okay. Now we're going to move on to the public comment period. It's an opportunity for anyone to speak on any item that is not on today's posted agenda. I ask that you keep your comments to 5 minutes or less. And I have 3 speaker cards. You don't have to fill out a speaker card, but it just makes the process go faster. And the first one I have is from Stephen Morrow.
Okay, thank you, Mr. Chairman, Supervisors, Mr. Hayes, and Mr. Bose. At about this time 80 years ago, the U.S. bases at Pearl Harbor were attacked by naval air forces of the Empire of Japan. Now, eventually, World War II would cost billions of dollars, millions of lives, and change our world forever. Now, most of those who served returned home and resumed their civilian lives, including my own father, grandfather, and great-uncle, but I'm sure many people in this chamber also had relatives who served during the war. But as always in any war, some sacrificed their lives so we can enjoy our freedom today. During my time in the Navy submarine service, I personally never came under enemy fire, but I want to tell the story of one man from the submarine service, adapted in part from Clay Bair's book, Silent Victory. Howard Gilmore was the skipper of the USS Growler when his boat came under attack. Mortally wounded during the attack, Captain Gilmore realized his heavily damaged boat and crew would not survive without drastic action. So he ordered his executive officer to take her down, leaving himself on the bridge to face the perils of the sea. His XO obeyed the order and submerged the boat. After the attack, XO Shad took the boat back and searched the area for Captain Gilmore, but no remains were ever found. Now, the Growler did survive, was repaired, and returned to action. Captain Gilmore was honored with the Medal of Honor for his service, but like many who served in the silent service, the medal was presented to his widow. Today, let us remember all who served during World War II and their families. All gave some, but some gave all. Thank you for the opportunity to speak today.
Thank you for that reminder, Stephen. Next, I have Emerson Drake. And I know you want to speak on a consent item also. I do have that.
Actually, I had questions on the consent item.
Yeah.
That's okay. Emerson Drake, longtime Modesto resident. First, I want to address Supervisor Chiesa. I'm not going to ask for a recount, but Supervisor Withrow, we're going to redouble our efforts in that poster contest, and we'll have more entries than he does next time. I'm just saying. Even more important to me today, it's not at the library week or whatever we have, but you know, one of the most important things we can do for our children is to have a strong library system. And in Stanislaus County, we can be very proud of our system. I usually use either the downtown or the Salida one, but you know, it's important. And this little card can make all the difference. The library card, I know it's an old one. I'm proud of that, by the way. But this card can make a difference. We've gone through my grandsons being read to from over there, my great-grandchildren, 2 of them now, getting books from over there, reading to them, getting them to enjoy the love of knowledge. I think that's extremely important. I just want to continue to support our library system. Like everybody else, they've gone through rough times. You know, they're cut back here, do this, do that, drop them outside, deliver them, keep you safe. You can't go wrong there. But I just wanted to speak to support them, that's all.
Have you had a chance to go by the Empire Library?
No, I haven't yet. I read about it, but I haven't been there to see it.
I'm going to tell everyone, Turlock's Library is beautiful, and it's again, I'm very proud of it, but I am so proud of the Empire Library. It is for the community, it is oversized for the community, and where there's need, we hope to be able to help. So appreciate those comments.
And the best part about them is if anywhere the book is in the system, you just place the order online, usually within a couple days, sometimes quicker than UPS. Not quicker than Amazon, I got to concede the point. I mean, Amazon, you order it one day, hey, it's there in the afternoon. I don't know how they do that stuff.
Yeah.
But you get the books, and we have an outside arrangements. We have a lot there to take your time, go through that website, the libraries, it's the counties, but still, and find out what the services they provide for us on a regular basis that most people aren't aware of. It's well worthwhile. Thank you very much.
Public service announcement, that was beautiful. Thank you. Next up, we have Emric Bassi. Dr. Bassi. Welcome.
Thank you, Mr. Chairman, members of the board. I want to thank Dr. V and Mary Ann for their presentation. I think that brings a lot to a better understanding of where we are with COVID. I'm here to give you some anecdotal evidence of what we're doing, where there are holes, where we can improve. Some of the things that I'm hearing as a provider giving monoclonal antibodies, I heard that there are nine people giving monoclonal antibodies. I'm not sure that is anywhere near the number that is actually giving monoclonals. I know that Oak Valley Hospital is giving monoclonal antibodies. They give 1 to 2 a week. I'm giving 10 to 15 a day, and our ability to give monoclonals is probably up to 100 a day if the need arises. I'm the owner of Elite Urgent Care in Modesto. We're very proud to bring this level of urgent care to the community and serve the community. Now, there was a question that somebody brought up as why are more providers not giving monoclonal antibodies? Well, there's a very, very clear, succinct answer to that, and that is nobody wants to see a COVID-positive patient. And that is across the board in our community. Most of the primary care providers are not seeing COVID patients at all. They're not seeing patients who have a cough. Pediatrics is not seeing any child that has a runny nose or a cough. I find that disturbing as a physician. My own wife is pulling her hair out that I'm seeing COVID-positive patients. What are you doing? Why am I doing it? The hospital, DMC asked me, because we had infusion capability in our urgent care, to go ahead and start monoclonal antibody infusion. Once I did, I found that the efficacy of monoclonal antibodies is very, very high. Now, again, this is anecdotal evidence. Of all the people that I've given monoclonals, which was upwards of 500 people already, I think one ended up in a hospital and ultimately expired there due to age, significant pneumonia. He did not, in order to be admitted to the hospital, you have to have an oxygen saturation less than 89. His was 91. So we have criteria that you have to meet in order to get monoclonal antibodies. What physicians need to understand about criteria is a template for you to understand where do we start? Who do we look at to give it to? Do I go by that template 100%? Absolutely not. At some point in time, common sense has to come into play. If I have a 25-year-old patient whose O2 stat is 91%, looks toxically ill, meets none of the criteria, am I going to infuse him? Absolutely I'm going to infuse him. Because if I send him to the hospital, they're going to send him home and tell him to quarantine. And if he looks that sick, I'm going to infuse him. Problems that we're having with infusion. Initially, we were only infusing patients who had commercial insurance. We came to Sacramento and asked them, can we do something about infusing patients who are uninsured and the huge Medi-Cal population that we have in the Central Valley. That was approved. Health Plan of San Joaquin reached out to me after some of the people up here got to them and offered me a contract for Health Plan of San Joaquin. I have not seen a single health plan patient as of yet, and I think we got that authorization a month ago. Not one. So when we're saying that we're making great improvements on letting the community know that these things are available to you, I kind of take that with a grain of salt, because I don't think enough is being done to promote the fact that there are certain physicians in the area who are putting themselves at risk and doing what they should be doing, and that is giving monoclonal antibodies. They're highly, highly effective. Right now, again, anecdotally, I am seeing 95% of my patients who are turning positive are unvaccinated. The rest of the patients who I am seeing are vaccinated in January, February, and March. I haven't seen a single patient beyond that who has been positive. So what does that tell? What tells me that vaccination works. That they're not coming in with COVID. It's the unvaccinated that are coming in with COVID, and the ones that needed a booster much earlier than 8 months. They needed a booster at 6 months, and that might have prevented them from coming in with COVID. So, I mean, I know my time is up, but there's a lot of information, I think, that needs to be presented to the board that you need to know from people like myself who are actually on the front line, who are giving monoclonal antibodies, and how we can improve that process, where we have delays, where we need more data. We need more data on nursing homes. I'm hiring
I'm going to ask you to wrap it up. I'm sorry.
I'm hiring LVNs, but I'm hearing that in nursing homes, positive patients are not getting treated with monoclonal antibodies. So there's a lot that needs to be presented. Thank you for your time.
Dr. Bassi, thank you very much for coming in. Very informative. Okay, so anyone else who wants to speak, I'm going to ask you to line up so we can.
Good morning, Corinne Whitlow. I just wanted to say really quickly after Dr. Bassi spoke, monoclonal antibodies is obviously something I'm passionate about. I've been kind of calling around myself trying to figure out if primary cares are aware of these. I know when we first started talking about it, I called my primary care doctor, Dr. Tremaine, and the office had no idea where I can receive monoclonal antibodies. I know that there has been a list sent out to physicians, so I attempted again to call my doctor. Luckily, the receptionist was really nice. She wasn't able to provide me with any information right away, but she did call a friend told me that I could maybe try Dr. Bassi's office. So that was friend information, not information from my doctor. I know I've talked about this before. Awareness is key. Nobody's going to utilize it if they don't know about it. Dr. Bassi just said they've had a contract with San Joaquin, health plan of San Joaquin for over a month and not had a single patient, because those patients tend to not have the same resources that a lot of us have, so maybe they don't even know what monoclonal antibodies exist or what they are. How are they supposed to know this information? I know I went onto the Stanislaus County Public Health website and tried to find information about monoclonal antibodies, and I'm not a extremely tech-savvy person, but I wasn't able to find an easy link to get me to the monoclonal antibodies. And then I just pulled it up right now. It's tucked under guidance, which I wasn't really looking there. But then you go and look at the website close to your zip code, and they say unclaimed. So it's kind of confusing. It's not a very good resource. I've asked that it be put on the main page, right under, there's vaccinations, there's testing, there's big points of topics there. It could easily be right there. We advertise vaccines everywhere. Monoclonal antibodies can be right next to that. It can be advertised in our pharmacies. It can be advertised at the grocery store doors right next to the vaccine thing. It can be on the freeway while you're driving. There's a beautiful light-up sign that now says, "Stay safe, get your booster." We can put information up there. Radio, I hear it everywhere. YouTube, there's information about vaccines. So I think there's plenty of opportunity to make this stuff available. And actually, the flyer that is on our public health website isn't a bad flyer. I just wish that we can actually get that out to our community. So thank you.
Thank you very much. Anyone else? All right, seeing no one, I'm going to close that's not a public hearing. I'm just going to close public comment. All right, we're going to move on to item 5, which is the consent calendar. We do have a request to pull B11. Would any board member like to pull any items? Anyone in the public want to comment on any of the other items? Okay, so I will ask Emerson Drake to come up for B11.
I wasn't expecting that sequence. That's my bad. I guess when I read let me start over. I received information from a local NPR owner, National Public Radio Station owner, that this B11 was coming up. And I looked to see, and I started being curious about it. It seemed to me we were targeting dispensaries, a legally run business. We're just targeting dispensaries. And I thought back, when we had an issue with almond theft, we didn't stake out Rayleigh's or O'Brien's. We didn't do that. But now we're seeing that we're using dispensaries to fund cameras that, when you read the agenda item, they're so good. Now, I don't have look, I'm not for car theft, okay? That's not the point. But there are some personal issues as far as, okay, you don't have any idea or any expectation of privacy in your car. But you don't expect to have a peeping Tom leering in down at the police department. The cameras, they say, are accurate enough to pick up dents off the car, to read the decals on a window. Well, if you can read the decal on the window, you can see inside the car, okay? At least that would be my expectation. And when we see where we're placing some of these, it's not about stolen cars. The ones up on Kernan, for an example, the ones at Kernan and McHenry, the others, the intersection just before it, it's slipping my mind now. At home I have it on the monitor. Pentecost, there you go, I'm sorry. And of course, Jane's Journey, which I find interesting because they appeared in front of you before it was legal because of the son's, he had the seizures, and it solved stopped that problem. But now we're staking out the area there, and when I talked to somebody earlier, and she was extremely helpful, I thank you, got information I couldn't find on the website, probably a personal issue. Mine, I mean, operator error, let's go with that. I couldn't find it on the Sheriff's Department, the ALPR policy 462, but she provided that for me, printed out. Still have to see if I can go find it myself. But if you look there, there's actually another exit at the top just north of Nino's up there, that would keep you, if you're trying to bottle it in, why not stick one up there? Because my wife would say, at least we get a few drunk drivers, right? The idea that a stolen car driver hops into this stolen car, runs to the dispensary, does whatever he's going to do and takes off again, doesn't hold water to me. He's going to run to the store. Let's go back to staking out Rayleighs that we never did. I mean, we do this for banks. When I see a license plate reader, it always comes back on the story that I've always, well, it's the regular one. Modesto always makes sure they fire theirs up, and they're up and down the aisles at Vintage Square Mall, or Vintage Fair Mall. Now, I've never gotten a ticket for that. Okay, I'm just throwing that out there. It's not, there's no axe to grind here. But the idea that businesses that provided the county in revenue 2021 $4.4 million, that we're going to stake their customers out. I just don't understand that. And that's exactly what we're doing. And the proposal is to do more. If you wanted that to be more effective, why would you have 2 cameras within a block of each other? It's not the dispensary that's asking to be made safe. If you think there's car theft going on, maybe you're suggesting that, I think it's Blessed Motors that's up in there. I don't know. It just doesn't make sense to me. And the idea that we have a peeping Tom looking in cars as it drives, I know that's being harsh. I agree with that. But by the same token, I don't see, license plate readers fine, but when you're looking in cars and that's what they're doing, I think it's wrong. I don't think the public expects that. And when I had to go back to November 24th of 2020 to even find out about this, that's on me. I'd never even heard about this arrangement you had. That apparently if the dispensary wants to sign in, they kind of have to acknowledge they're going to spend the money to fund these cameras. Now, we're spending enough money, people. Do we really want to bother? I'll bet these car thieves, I'll bet they're going on the ice rink over here around the corner. I think we should stake that out too, okay? Most of the cities just barely monitor the license plates. This system appears to be more invasive. My understanding is they can keep the information for 90 days. I don't understand why we're doing this. Are we did car theft become that big a deal all of a sudden in Stanislaus County a few years ago? We had issues. Modesto always took the heat, so I thought, well, who would care, right? But I'm just concerned. It was bad enough that the coroner has to stand up. I want the other guy's time.
No, go ahead and finish your thought. Finish your thought.
You got a good one there. It's bad enough when it comes to the vaccinations. We have the coroner up here being part of the system, and the sheriff, of course, won't enforce any mandates, but that's okay. But by God, when somebody wants to buy something that's legal, we're going to go over the top of the hill and make sure they can. I don't understand that. It's something I don't think we should be doing unless we're going to acknowledge on the front page of the paper that we're going to hunt down anybody that turns into one of these legal businesses. And if you don't want the 4.4 million, give it to the homeless. Yeah, I know, right? Thank you very much for your time.
Thank you, Emerson. And so, I'll just tell you, it's my perspective, because I'm the one that's been pushing this, and this is not the money that's being used from cannabis to fund these cameras is not because of the Sheriff's Department, it's because of the board, specifically myself. When we went to Denair Mac, and when I went to the Hickman Mac, and we were talking about putting a dispensary in Denair and a grow in Hickman, there's a lot of concerns in the community that there's a problem. If you look at the locations of those two specifically, and you're right, the one on Pentecost and Kiernan is probably the most suspect of them, but if you look at Main Street and Santa Fe and Denair, it's the most traveled road through Denair. If you look at Hickman and Lake, it's not near the grow, it's not, and so they're high capacity areas. So they'll have dual purpose. I can tell you, though, spending this money is supported by the dispensaries. The intent is not to watch people who are going to the dispensaries. And so we have to make sure, again, I have to be absolutely sure that that's not the case. And we had picked these locations, I know, with staff, with Tara Chumley and myself, sitting with Lieutenant Humble and the sheriff, just talking about high trafficked areas. There has to be some association, because we're using cannabis money to the dispensaries and or the grows. But again, out in Wesley at the corner of Howard, Ingram, Creek Road, you're trying to find higher trafficked areas. The LPR, I always tell one story, and it goes back to exactly what you're talking about on the stolen cars. Last summer, I was up in the sheriff's helicopter on a patrol, a routine patrol. We were in Empire circling, I know exactly where we were, over Church. It was a domestic violence case. And we were waiting for an officer to show up as we were tracking a suspect. The officer shows up, and the LPR, because City of Modesto has license plate readers at certain locations, but this was over on Paradise Road, one hit on a stolen car. We were literally over Empire, took off straight towards where the license plate reader was, and I'll tell you just basically, but there's I think a Save Mart right there, the location. 10 minutes we had the car, and we had a stolen car caught. And those stories are over and over and over again, as we end up with more liability in Stanislaus County for stolen cars, chasing accidents. We're finding more and more of the risk is taken by us. And having these LPRs, and especially the airship, it makes a big difference in the whole factor. So I'm very supportive of this, but I don't disagree that we shouldn't be putting them to watch the traffic that's going in and out. That's not the intent. But it is a safety concern, and that's why we have the support. I know Tara has spoken with the folks that have the dispensaries and or that are paying the tax. And I think this is a good way to spend that money. Again, it's a safety concern. The MAC in Hickman and the MAC in Denair are extremely happy that we're doing something like this. Again, it's just picking up traffic. But it's just another law enforcement tool that I think will help us in the long run. And so we'll redouble our efforts.
Yeah, and if you don't mind, I just want to add one more word. I think everyone knows by now that we've had some experience throughout California with the legalized cannabis industry. And there's no question that as one component of that there have been attempts for individuals to commit crimes within those jurisdictions, within those areas. We heard a lot of spirited debate about whether or not we should have a program in Stanislaus County, with a fear that it was going to attract more crime for individuals that were going to come and potentially conduct crimes at a legal business. And in this case, we are using this as just one of the tools to try to protect the areas around those dispensaries, not to try to monitor individuals who are using the businesses, but to ensure that if something does happen at any one of our permitted locations, that our law enforcement team can respond very quickly, shut it down, and send an example to anyone else who wishes to prey on our legal cannabis business, that it will not be tolerated in Stanislaus County. So we actually view it much the opposite of what I was hearing in some of your comments, that this is for the protection of the industry and our community here. and we'll see how it goes over the next couple of years. Thank you.
Appreciate your comments. Emerson, anyone else? Okay, now I'm going to bring back, if there's no other comment, we'll take the consent calendar together. Do I have a motion?
Make a motion to approve the consent calendar.
Is there a motion?
I'll second it.
And a second. All those in favor say aye.
Aye.
Opposed? Motion carries 5-0. Thank you very much. We do have 3 public hearings today, and the first public hearing is a public hearing to consider the adoption of the Modesto Groundwater Sustainability Plan. And Walter Ward, who led us today. And I made a big mistake by calling you the Water Resources Manager when I'm supposed to call you the Water Guru of Stanislaus County.
No, have to call me down.
Rob, you will be leading off? Okay, I'm sorry.
Well, good morning, Chairman Chiazza, Honorable Board, CEO Hayes, County Council Bose, and the public. Rob Koslevy, Department of Environmental Resources. Before you today is an item for your board to consider regarding the adoption of the Modesto Groundwater Sustainability Plan, or GSP. It's staff's recommendation that we conduct a public hearing to consider the approval and adoption of the Modesto GSP, 2, approve and adopt the resolution regarding the Modesto Groundwater Sustainability Plan, and 3, authorize the Modesto Groundwater Sustainability Agency, its consultants, and the plan manager to take such other actions as may be reasonably necessary to submit the Modesto Groundwater Sustainability Plan to the California Department of Water Resources by January 31st, 2022, and implement the purpose of this resolution. I would like to introduce the Department of Environmental Resources staff, Walt Ward, who is our water manager, and Faye Temez, our staff service analyst, who will be covering the presentation this morning.
Thank you. Good morning. It's been a while since I've been here with all going on, and it's a pleasure to introduce Faye Temez, who for the last 3 years has really been my right arm, and she deserves a lot of credit and respect for her work, and I'm glad she's here today. Hopefully my voice will hold out. But I was thinking about it earlier this morning. It seems just like yesterday that we were talking about Sigma and Governor Brown signing it and all that back in September of 15. And we all had these dates out in front of us and all this work. And I mean, it's been hundreds and hundreds of meetings and thousands of hours, and all we're doing really is getting to a starting line. So with hopefully your action today approving the Modesto GSP, you know, it sets us on a course, a long-term program in terms of groundwater sustainability in our region. And with that, we'll move into a presentation. Hopefully I don't get too wordy. Next slide, please. As Rob described, we are required by the law to hold a public hearing. So that's the main purpose today, is open it up for a public hearing to hear comment prior to your consideration of approval and adoption of the Modesto Groundwater Subbasin Groundwater Sustainability Plan. A lot of syllables there. All right, next slide. There's probably nobody in this room that hasn't heard of Sigma, but if you haven't, it's an acronym that stands for the Sustainable Groundwater Management Act. And that was passed into law back in September of 14. And the effective date of the law is actually January 15th. So it's been around for quite a few years. The keystone of Sigma, in my view, is the establishment of local control. And the local control is through the formation of what are called groundwater sustainability agencies, otherwise known as GSAs. And I think the formation of the GSAs in and of itself is quite a story, and it's one we should all be proud of, and I'll get to that in a little bit. But the GSAs are empowered with quite a bit of authority and responsibility, frankly. First of all, is to develop these long-term plans, what are called GSPs, groundwater sustainability plans. So, with the uncertainty of looking out over a 50-year period, but that's what is required. So we're trying to look out over the next 50 years and implement projects and management actions and policies over the next 20 years to achieve a measurable sustainability of our groundwater resources. And I'll talk a little bit about what those elements are. So we get to a starting place, right? And a plan in and of itself doesn't achieve anything. You have to implement it. And so as we begin to implement the plan, there's regular reporting, there's regular data collection, there's 5-year updates as you make your progress toward your defined sustainability criteria. And we've spent a lot of time talking about all sorts of different approaches. Next slide, please. So the idea to begin with is that you have a groundwater basin that's been defined by the state, and you describe that basin setting. How big is it? How thick is it? How much water is there? What are the what's called needs and sources? In other words, a water budget. You have urban demand, you have agricultural demand, you have environmental demands, you have surface water, you have groundwater. You describe all that. And the idea is to establish measurable parameters that allow a determination of the long-term sustainable yield. And that long-term sustainable yield is defined locally, and it's going to be different up and down the state. For our region, the GSA is looking at defining a sustainable yield and using the regulations contained in SGMA to avoid undesirable results. That sounds like a bunch of gobbledygook, but I'll explain what that means here in a little bit. So you avoid undesirable results, and by doing so, you are achieving sustainability. So, in other words, by not causing harm to the resource, you're achieving resiliency in managing your water, right? You got to collect a lot of data to do it. And so a monitoring network has been established with representative monitoring points where we'll collect water level, water quality, compile all that information into regular reports that define the water table surface and how it's moving up and down. There's no way you can manage water, whether it's surface water or groundwater, in a flat line, static condition. It's always going to move up and down. It's seasonal dependent, it's hydrogeologic dependent, it's dependent on wet years, dry years, and everything in between. So it is data intensive in the way that enough information is gathered from the field to help you make these determinations. And that takes a lot of coordination, cooperation, a lot of communication. It takes community participation. That's really the key. And as you have defined the sustainable yield and you're collecting these data, it's really working both sides of the equation, both the supply side and demand side. And by implementing projects and taking management actions. Again, the authorities given through SIGMA to the GSAs to not only develop the GSPs, but to implement and conduct them involves, regular reporting and speaking to the community and working with both the urban and agricultural community. And hopefully fostering this cooperative spirit and building and operating and funding projects, and frankly, down the road, probably taking some pretty significant, actions in terms of enforcement where we encounter problems, because we will encounter problems. Next slide. So, okay, milestones. When this first came out, the big thing was this June 30, 2017. If we failed to create the GSAs, the state would have been in here and taken over. So the big hub at the beginning was getting everybody together and trying to figure out how to create these GSAs. And we did it, and it's remarkable. It really is. And we should all be proud of how we came together, and I'll show you a little slide on, give you a flavor of that complexity. So the first deal was creating the GSAs, and we did that, and we did it up and down the region. The second deadline was the initial GSPs, the groundwater sustainability plans. This body has already adopted 2 GSPs. That was a couple of years ago. I have a slide showing that. And that was for the basins that are considered to be critical condition of overdraft. That wasn't our determination. That was told to us by the state. Certain basins in the Central Valley are in a critical condition of overdraft. And they were required to develop and adopt their GSPs by January 31, 2020, 2 years ago. And I'll show you a slide where we here locally made that deadline. So today we're here to bring to you what are called the high and medium priority basins, the other basins that aren't critical condition of overdraft. And their deadline is January 31 next year, 2022. So that's why we're here today, to help meet those deadlines. And if you do miss the deadlines, you're basically saying you can't get it done locally and you're going to turn it over to the state. That's not an option, right? I mean, that's just not an option. Not to coin a phrase, but failure is not an option. So we're working together on multiple levels to bring this and keep it moving. And next slide. So I do not want to go into technical stuff with you guys. I mean, I think that's not your interest. I mean, it's all in the plan. It's we've got hydrogeologists and engineers and everybody poring over this stuff. But these are the 6 areas of concern. And in Stanislaus County, it really is the first one, the chronic lowering of groundwater levels, that is really the key, because it serves as a surrogate for almost every one of the others. It translates into the very next one, significant unreasonable reduction of groundwater storage. When you have groundwater level decline, you're removing water from storage. Was that significant unreasonable? There's a lot of groundwater. And how you manage that is the key to these GSPs. The number 3, significant unreasonable seawater intrusion, not an issue. We do not have seawater intrusion in Stanislaus County. Significant unreasonable degraded water quality. For the purposes of the GSP, we really are taking a position that there's many other state agencies and other programs that are in place that key in on water quality degradation. the GSPs are recognizing those other programs. We're not taking a position to usurp or take over, but to basically stay out of the way and not cause further harm. So a lot of communication coordination with the other agencies and data collection and water quality problems. But the idea is that the GSPs and in their implementation will not cause further degradation. That's sort of the keystone. Significant unreasonable land subsidence is not an issue in Stanislaus County. It certainly is further to the south in other parts of the San Joaquin Valley, Tulare Basin, and it's been creeping northward up into the latest data kind of shows Madera County is this epicenter of these subsidence issues, and it is a big problem. But it is not a problem in Stanislaus County. But the last one, though, is very interesting, and that is this idea that the river systems are connected to the groundwater. In some cases, the groundwater actually is feeding the base flow of the rivers. In other areas, the rivers are providing flow into the groundwater basin. And they're called losing reaches and gaining reaches, and depending on how you manage the groundwater, you can reverse that. In other words, there might be a section of the river that historically has gained because the groundwater is feeding it, and by pumping activity, you can reverse that, and you can now cause the river to lose water into the basin. So we have to be very careful about intercepted surface water as a result of groundwater depletion. So that's a big deal. Next slide. This is about as technical as I'm going to get here, but picture the bottom going from left to right, the 20-year period. And so we're starting out at the far left, go up to the top where it says current condition. And so groundwater levels will move up and down as you go over time. But for the condition of establishing what is a undesirable result, we establish what is called a minimum threshold. That's a yellow line that just is drawn horizontally across the bottom of the graph. If we continue to draw our water levels at these representative monitoring sites, if we continue to draw that water level down below the minimum threshold, we are creating an undesirable result. We would then be in default. We would not be sustainable. So the idea is to avoid that. And so we're setting the green line as what is termed a measurable objective, an MO. So you set the measurable objective so that over time, and nothing's going to look at this graph. It's just a cartoon of the concept. But the idea would be over long term, at each of your monitoring sites, you're able to achieve some sort of an average measurable objective that is above the MT, above the minimum threshold. And so by doing that, you created an operational area of flexibility for groundwater to go up and down, but you haven't drawn down the water in such a way that you overpass the minimum threshold and put yourself in default. So it takes a lot of data collection in order to feed that back, and I think I have that on the next slide. Next slide. So embedded in the GSP is this idea of adaptive management, right? So the upper picture, this is I guess a clock. So from noon to 3 o'clock, you develop the plan and then you do the plan. That's that section of the graph here from 3 o'clock to 6 o'clock. And as you begin to collect data, you learn a lot more. I mean, is the plan perfect? Hell no. I mean, did we get everything right? No. I mean, we're in full compliance, we meet every part of the regulation of the law. It's ready to go to be submitted to the state, but we're gonna learn a heck of a lot as we begin to collect more information, talk to a lot of people, get more people involved, more participation in the process. And as you do, you're going to adjust the plan. And that can be as you go. I mean, we know we have to do 5-year updates. We know we have to do annual reporting. Well, we can adjust the plan as we evolve, as we implement. It's called adaptive management. So we can implement projects and take management actions as new information, new data comes to light that changes our course. And that will happen for sure. Next slide, please. So what is this Modesto groundwater basin? Well, if you look at this graph, you can see Stanislaus County. We've got 4 groundwater basins below Stanislaus County. The basin to the north, what is called the eastern San Joaquin, is that northern triangle piece of the county, is a basin of critical condition of overdrive. I've got that little asterisk by the name eastern, and that footnote reads that denotes a critical condition of overdrive basin. You guys adopted the plan for that basin 2 years ago. Likewise, to the west, on the west side of the San Joaquin River is the northern finger of the Delta Mendota Basin, which actually extends 20 miles further south across into Merced County, into western Fresno County. But in Stanislaus County, we have this little northern, what is called the northern region of the Delta Mendota Basin, and a GSP has been adopted there 2 years ago. So the 2 remaining basins that we have in Stanislaus County, after which the entire county will be covered by existing GSPs, we have the Modesto and Turlock. Turlock, you can see, straddles Merced County. Nothing unique about groundwater. I mean, you know, it doesn't recognize any political boundaries. The Turlock Basin is also scheduled to be adopted, the GSP, scheduled to be adopted and submitted by January 31, 2022. The governance structure for the Turlock Basin, though, is a little different than the Modesto. And I want to explain that, why Turlock isn't before you today. Turlock is created through a joint powers agreement. So there's a West Turlock GSA and there's the East Turlock GSA. Both of those are JPAs. They have their own governance structure, their own board of directors, their own budgets, you know, their own decision-making authority. And that is provided under SGMA. January 6, 2022 is the scheduled date for a joint East and West Turlock GSA board meeting to adopt the Turlock Basin. They do not have to come back to each of their member agencies, organizations, because they've all been rolled up into a JPA. So that's where the decision-making authority resides with Turlock. Modesto is a little bit different, and I'll go into some more detail right now. Across, let me come back to this slide. Go to the next slide. All right, here's the Modesto subbasin. And you can kind of think of it, and this is maybe unique, I'm not quite sure. It is all but for 1,800 acres, it's entirely contained within Stanislaus County. There, if you see the diagonal line on the far right, I wish I had a pointer, but I don't. That's the boundary between Stanislaus and Tuolumne County. And you can see where the tan buff color kind of gets truncated. Well, the basin doesn't get truncated like that. But there are these little fingers of overlap that add up to about 1,800 acres that's actually in Tuolumne County. But all the rest of it is in Stanislaus County. So it's that entire region of Stanislaus County that is south of the Stanislaus River, east of the San Joaquin River and north of the Tuolumne. So if you look at all those colors, those are jurisdictional service areas, right, of various public agencies such as Waterford, Oakdale, Riverbank, Modesto. MID in green, OID in that aqua color, and all that tan buff color is unincorporated Stanislaus County. So we have quite a collection of different agencies that are all working together for a common goal, common purpose, common cause, and that's groundwater sustainability across this basin. Now, Faye, go to the previous slide. And I should have these slides reversed, I apologize for that. If you look at the different agencies across Stanislaus County and superimpose it on top of the basins, right? Remember the brown basin to the north is east in San Joaquin, the yellow across the middle there is Modesto. You remember when we just talked about Turlock and the northern finger of the Delta Mendota. All these other colors superimposed are, frankly, 9 cities and 10 different water agencies. State, federal, local control, OID, MID, East Side Water District, West Stanislaus, Del Cordo, Central California ID, Patterson ID. I mean, a complexity of different agencies that all have different governing boards, different budgets, different issues, different sources of water. But the thing they all have in common is they're here in Stanislaus County and largely supporting our agricultural industry, which is our economic engine. So it's really important to praise, I think, to recognize the formation of the GSAs that brought sort of this hodgepodge of often, depending on the situation, conflicting parties, and sometimes, they're your ally, and on the next issue, they might be your enemy. But in terms of groundwater, we're all together. Next slide. So Modesto, back up one more. Okay, so we just talked about what's here in the Modesto Basin. So we have the entire basin covered, so we're in full compliance with the state. You can't have any overlap or leave any holes. We did neither. We've got the entire basin covered, and we're preparing one single GSP that covers the entire basin. So let me put that in contrast to the Delta Mendota Basin on the west side of the San Joaquin. That particular basin has 23 GSAs and prepared 6 GSPs. So, I mean, that's pretty complicated. And they're in the same place. They're just getting started too. But in the Modesto Basin, it's one GSP covering the whole basin, and it's essentially one GSA doing all the work. That's all the 4 cities, the 2 IDs, and then we also have that relationship with Tuolumne County. And by the way, this body approved a long-term contract or agreement with Tuolumne County to be a support service. So Stanislaus County is actually carrying Tuolumne County for the purposes of the GSP, but Tuolumne County is contributing financial resources and economic resources and information to support the cost. They also will be adopting the GSP, and that is something that will happen later next year. So the main GSA in the Modesto Basin, you guys maybe heard of this, Stanislaus, Stanislaus and Tuolumne River Groundwater Basin Association. That's the primary governance structure, and again, that's the 4 cities, the 2 IDs, and the unincorporated county. Their governance is a MOU, memorandum of understanding. So when financial decisions are made and when adopting plans like this are made, each of those entities, each of the cities, the 2 IDs, and the county have to take action, and that's why we're here today. All this information is on a webpage called sturpa.org, and you can go to that, anybody in the world can go to it and gather information on meetings and upcoming meetings, agendas, minutes. But in particular, as in regards to the GSP, they can go there and find the entire document. We have provided a hard copy to the board clerk's office, and we've got one out of our office on cornucopia, so that people can come in and look at it if they don't want to look at it on the webpage. Repeating it, I guess it's worth it, because I think this is an outstanding organization. It's essentially been around since 1994, and so when Sigma came along, just sort of picked up the duties as it was already sort of conducting. Waterford was a late entry, but we modified the MOU to bring Waterford into the organization. But this is the group that has been putting together the GSP, and this is the group that will be implementing the plan and preparing the annual reports and the 5-year updates. And at some point in time, we have talked about transitioning from an MOU to a JPA, so we may be bringing that back to you to endorse and agree with that. That'll give it a little more independent decision-making authority. We would ask that this body identify a couple of representatives to serve on that board of directors, but that's something for down the road. The next slide. So part of the process in adopting the plan is public noticing, and I realize how difficult it is with the pandemic and even all the meetings and all the Zoom, and I wish we had more public there with us, but we did do our best with what we had. And part of the steps in setting up today was back in August. You guys may or may not remember, you set a hearing date for today. It was on your August 31 agenda. So that was the first step. We also had to publish in the Modesto Bee, and those public notices were November 21, had run for 2 weeks running, back-to-back November 21, November 28. We accomplished that. We'll make sure that's in the record. So we bring before you today this consideration, and so the first is to conduct a public hearing to consider approval of the Modesto Groundwater Subbasin GSP. That's to ask you to approve and adopt by resolution the GSP for the Modesto Groundwater Subbasin. Number 3, probably the most important part, to authorize the groundwater sustainability agencies, remember Sturba and Tuolumne County, and their consultants and their plan manager. Part of Sigma says, we don't want to have to talk to a bunch of people. You guys designate who's going to be the plan manager. That's an entity and a person who works for that entity. It'll probably be somebody at OID or somebody at MID, I would guess. So we haven't taken action yet on naming our plan manager. If we have, I don't remember that. But give authorization to plan manager to take all necessary actions to make the deadline, submit the GSP to the DWR, and implement the purposes of the resolution. That's our staff recommendation. I think that's the last line.
Okay. So there were 3 GSA plans that have been turned back, I think, by California's Department of
There's been more than that, but yeah,
Is there-
recently, the Eastern San Joaquin and the Delta Mendota were found not necessarily to be non-compliant, but insufficient and deficient in certain categories.
Okay. And you don't expect, not that you would be putting a plan forward that you thought might be turned back, but what's your confidence level? Because I know there's a little more consternation south in the Turlock Basin than there is in the Modesto Basin, but
I mean, it's an opportunity for us to learn and anticipate where the problems might be coming from and to address them now. So we are preparing to do that. But insofar as responding to the DWR, we have a team of people on both of those sub-basins already working on it. A lot of it is being driven by disadvantaged communities and potential impacts to private domestic wells that DWR does not think were adequately addressed in those GSPs. So it kind of gives the Turlock Basin and the Modesto Basin a bit of a heads up as to where you maybe need to beef up your plan and in particular your response plan if in fact you do have dry wells. So we're spending a lot of time in the Turlock Basin on that response matrix to report dry wells.
okay. Thank you. Any questions for Walt?
I don't have any questions. I'm just going to praise you here a little bit, Walt. Over the years, look back at how this all kind of started. And this county really kind of led the charge before Sigma even happened. I mean, if you remember, we were in a situation of the last drought, and we were in a spot where we were having wells starting to go dry, and we had a real public outcry. I think just probably Vito and I were the only ones here at the time back when this all happened. And there was a real push back then for a moratorium here in our county, for us to put a moratorium on wells right in the heat of the crisis of the drought, and there was a lot of pressure on this board to do something about it. There had been talk of an ordinance. Jim DiMartini had been working on a groundwater ordinance for a few years, and then it finally came to a head when Jim and I remember went to a, I don't know how many years ago this was, 8 years ago maybe, somewhere around there.
November 2014.
Yeah, so 7, yeah, and Jim and I met in the room at the Farm Bureau with everybody representing the irrigation districts, and cities were involved. At the time, you were working for MID, and I remember we sat there for the first 2 hours, and it was just basically, if I can say this, a bitching session of everybody yelling at the county, myself and Jim and our staff that were there at the time, saying, what are you doing? And Walt, you were one of the main ones.
Tom was there.
Yeah, Tom was there too. Saying, what are you guys doing getting in our business? You have no business getting in water. So I remember that went on for about 2 hours. And then we took a break and then kind of huddled up with staff and then came back. And I remember saying, I appreciate all your comments, but we're going to get involved in this business whether you want it or not. And you can be a part of it with us or not. And then I remember then you coming up to me after the meeting, and not only did we get involved in the business, we hired you to be the lead of it, to head this thing. And that was the best move we ever did, because you've just been a superstar in guiding us through this. And what we did is we put together a water advisory committee at that point to try to get all the players involved. And we started working on building relationships with everybody. When here the county was coming in and sticking our nose in their business. But we built these relationships with everybody, and you were a good part of that. You were our liaison, I would say. Like I said, the best thing we ever did, because you had the credibility to sit in those rooms and those conversations where the rest of us didn't. And so it helped build those relationships and build trust amongst everybody. And through that, we did come up with a groundwater ordinance that seemed to work for everybody. at the time, which nobody thought we were able to do. And then from that, we had, and I think even, like I said, Sigma hadn't even started at that point, but it was coming. And I think then we were looked at as an example of how things should be done throughout the state. And as a result of your work, and I think even language involved in Sigma kind of came out of stuff that we put together back then. And from that, we were then prepared. So as Sigma came into place and the GSAs had to be formed, and now we were with GSPs and our third one, it was because those relationships had been built. We started that time, we built that trust with everybody, and these things happened because of all the work that you did before, Walt, to get this thing going. So I couldn't be more proud of what you've done here in this county for us to really put us in a spot kind of ahead of everybody else when this all started to happen, and really a leader in the state for what's gone down, and for the way that everybody has worked together. I know it hasn't been easy the whole time making these things go, but and even to the point where, you know, at one point we convinced everybody we needed a programmatic EIR for the whole county. And now it has come full circle that we're probably going to be able to use that programmatic EIR to deal with the current lawsuit that we've been hit with, the ruling that's come down from the Supreme Court of California. We're hopefully going to, and Tom's going to be working on that, I know, to figure out a way that we can use the work from that programmatic EIR to reduce the cost in our well permitting process that we were up against now when it comes to these well permits. So anyway, just couldn't be more proud of what you've done and your hard work, and I appreciate, Faith, everything you're doing too. And so not a comment, but just a praise and a history for everybody else here as to how we've got to this point. And it hasn't been easy, and it's been a lot of hard work by the county, by the irrigation districts, by the farmers who've been participated in this and really done good work for us. So thank you all for all you've done.
I appreciate that.
Ditto.
I've been doing this for almost 40 years. And the last 8 have been the most rewarding.
It's rewarding. It's great. Any other questions or comments before I open up the public hearing? All right, seeing none, I'm going to go ahead and open up the public hearing. Anyone that wants to come and speak on this subject, please come forward, state your name.
Emerson Drake again. I agree with what he says, Walt. Followed you with MID for a long time. But a long time. That's starting to bother me now.
We go back.
But I truly do have some concerns, and I haven't read this, so I can't, I'm not suggesting it doesn't cover it. We know that we have water quality issues here in Modesto. We know that the west side of Modesto, or just past our border, the water is so heavy with nitrates you're not supposed to drink it. We know to the northeast, just east of the feed store on McHenry, where the Levy's live, the water is so bad there they can't drink it. The nitrate levels are 4 times the allowable amounts. There's a nice government sponsor that's actually done by farmers, I believe, a program there that provides them water to drink. Unfortunately, in one instance, they have an 81-year-old woman trying to shuffle 5-gallon jugs of water in her home, so we're trying to rectify that just a bit. We see Trinitros with their huge, deep straws into our lower aquifer. You know, it's a concern. San Joaquin County makes farmers account for all the water they pump. We don't do that, I don't believe. At least we didn't the last time I checked. I've got a concern that at MID, they're actually trying to find a way. John's already told the attorney to work on it. They've got an agreement with the city about a water sharing deal with the farmers, and it depends on how much farmland gets turned into city land. And anyway, I mean, it's kind of a long and involved. They're trying to steal water from the farmers because they figure the farmers will just pump more water to begin with. And if the sheriff wants to help us out, if you want to put some plate readers up around MID, because those guys are stealing us blind. I mean, okay, not you, sir, not you, sir. I'm talking about the board, okay? Big difference. You can tell people what they should know, and they can ignore it. You know, we're still subsidizing farmers' water. They pay $16.25. They cost $55 to deliver. We turn around and What did I see recently? We're subsidizing Gallo at $5 million a year for their electricity. We actually provide rates to those businesses south of Yosemite, less than cost at night. Less than cost. I mean, a discount's okay, but when it's less than cost, it's coming right out of our pockets. So my concern about the water sustainability, are we also working in the quality of the water? I mean, it's nice to put a yardstick in the bottom and see how much is there, but what is down there is the question. When I see the map on, actually it's entire Wood Colony, it's red because you can't use the water. You can't drink it anyway. You see it on the north side more and more. You can't see it too much in Modesto because there's not enough houses up there to do. I hope that we continue to watch the quality of the water. At the same time, we're watching how much it gets pumped out, because everybody knows by the time the red flags goes up, it's like down south, it's too late. And I'm sure you're addressing that issue, and I thank you for that one. Never let a guy get up his nose just a little, right? Thank you very much for your time.
Anything you want to comment on that, or just on the how Sigma's going to bring into balance the pumping?
You know, the water quality and the protection, the degradation of it is one of the key parameters of the plan. I mean, it's one of the 6 resource areas, so it is an issue. It's on our radar, and we will be addressing it.
Any estimates countywide, while looking through Sigma in both basins, what the potential retirement without offsets of utilizing Dry Creek water, getting more surface water, what the potential idling of land might look like?
Not thought.
Idling meaning not farming.
Oh,
Yeah.
you know, that hasn't even come up. It's not even something we're looking at. It may be, but it's not in the initial plan. We are looking at both sides of the equation. We're not calling it idling, but we're saying demand reduction. So anything that you can do to become more efficient reduces demand. Your different mix of crops changes the demand. Timing and scheduling changes the demand, not the overall extraction, but it changes the pattern of the drawdown.
Yeah.
We're looking at everything.
I think the Public Policy Institute had said south of this area, where there's, especially where there's subsidence, they're talking about, their early estimates are 750,000 to a million acres. Yeah, to a million acres, potentially idle.
That's in Kern, Tulare, and
yeah.
I mean, they're looking at these, making land use decisions that change from agriculture to some other light industry. And that's the part about Sigma that's important. There is a strong nexus between land use planning and water supply, which frankly has been lacking, I think, in long-term California land use planning.
Perfect, thank you. Anyone else? All right, close the public hearing, bring it back to the board for action. Or questions?
I'll make a motion to accept all staff recommendations.
Second.
And we have a first and second. All those in favor say aye.
Aye.
Opposed? Passes unanimously. Thank you, Rob. Thanks, Walt.
Thank you.
Hey.
Yeah.
Faith, faith, faith. Appreciate it. Okay, on to our second public hearing. And we didn't have any public comment on, not written comment on the first public hearing, and I don't see any for the second public hearing either. Is that correct?
Yes, you are correct.
Okay, second public hearing is a hearing to consider Planning Commission's recommendation of approval to rezone applications PLN 2015-0030. It's Blue Diamond's request to amend the zoning designation for 2 parcels totaling 42.99 acres from limited industrial to general ag A210 and planned development PD 43 to a new PD, which will allow for future expansion of the existing processing and storage facility. I turn it over to Angela.
Good morning. I'm Angela Freitas, the county's planning director. With me to present this item is Teresa McDonald, and I'll just turn it over to her to get us started. Good morning, Teresa McDonald, Associate Planner, here to present rezone application number PLN 2015-0030 Blue Diamond. This is a request to amend the zoning designation of two parcels totaling 42.99 acres from limited industrial, general agriculture, and planned development 43 to a new planned development to allow future expansion of an existing almond processing and storage facility and to consolidate existing operations into one zoning district. The project site is located at 4800 Sisk Road, 4498 Kiernan Avenue, and 4743 Nutcracker Lane on the southeast corner of Kiernan Avenue and Sisk Road in the Slide area. The project site has a general plan designation of industrial and planned industrial, a community plan designation of industrial and planned development, and a zoning designation of limited industrial, A210 general agriculture, and planned development 43. Surrounding land uses include orchards to the north across Kiernan Avenue, an agricultural chemical company and light industrial uses to the east, Boomer's Amusement Center and the City of Modesto to the south, and the Salida Public Library, commercial uses, and Highway 99 to the west. The project site is currently approved with structures approximately totaling 631,000 square feet, with 12,125 square feet for the retail store and administration facilities, and the remaining square feet consisting of warehouses for the almond processing and storage operations. The site is also improved with landscaping, a monument sign, and a 332 parking space lot with 16 light poles. The rezone application includes new construction totaling 240,300 square feet, shown in orange, and includes additions to the manufacturing building, main processing building, 4 of the existing bulk storage warehouses, the retail store, and a new covered scale and bulk storage warehouse. The facility operates 24 hours a day, 7 days a week, with 154 employees on a maximum shift and 3 shifts per day during their peak season, which typically runs from August to May, and 74 employees on a maximum shift during June and July. Approval of this request is expected to increase the maximum number of employees on site to 185 from August through May and 89 during June and July. The operation currently generates a varied amount of truck trips depending on the month, ranging anywhere from 136 to 176 per day from July through February, and a maximum of 81 daily truck trips from March through June. Daily truck trips are expected to increase to an estimate ranging from 163 to 211 from July through March, and an estimated maximum of 97 per day from April through June. Pursuant to CEQA, the proposed project was circulated to interested parties and responsible agencies for review and comment. In response to the original initial study, the Air District requested an air quality impacts be assessed. Accordingly, a health risk assessment was prepared, which found impacts to be less than significant. Although not requested, a traffic circulation assessment was also prepared for the project. The initial study was also amended to correct an error regarding the existing light poles. Based on the comments, a negative declaration has been prepared for this project. Typical development standards have been applied to the project, which can be found in Exhibit C of Attachment 1 of the board report. Correspondence was received from Brad Johnson in response to the project's amended initial study, raising concerns regarding air quality, dust, truck routes, parking, stormwater drainage, and Salida Fire Protection District fees, discussed in the issue section of the Planning Commission staff report, included as Attachment 1 of the board report. As part of this project, as stated previously, a health risk assessment was prepared at the request of the Air District, and the conclusions reached in the assessments, along with the development standards being applied to the project, staff believes all of Mr. Johnson's concerns are being addressed. The issue section also addresses the height of new freestanding light poles being limited to 24 feet in height, which exceeds the standard height limit of 15 feet above grade usually applied to new discretionary projects. General plan consistency must be evaluated when processing all discretionary project requests, including the project site's general plan land use designation of industrial and planned industrial, the Salida community plan designation of industrial and planned development, the sphere of influence policy, and the agricultural buffer standard. The item was presented to the Salida Municipal Advisory Council on September 28, 2021. Community members and MAC members asked about dust, traffic, air quality impacts, and the capacity to accommodate increased volume. The MAC voted to support the project on a vote of 3-1. The project does not meet the 150-foot wide agricultural buffer from the parcel to the east and includes a request for an alternative consisting of a reduced setback of 87 feet. The agricultural commissioner had no objections to the project as proposed. To approve a rezone, the planning commission must find that it is consistent with the general plan. If the project is approved, the zoning designation of PD will be consistent with the general plan designation of industrial and planned industrial and the selected community plan designations of industrial and planned development. Based on off-street parking standards, the project would require 229 parking spaces at full build-out, and PD zoning also allows for establishment of specific parking requirements. No additional parking is proposed as the site is already improved with 332 parking spaces. Proposed construction will further maintain general plan consistency by being limited to 75 feet in height for buildings for human occupancy and 70% lot coverage of the property by buildings. The Planning Commission considered this item at a public hearing on October 21st, 2021. During the public hearing, no one spoke in opposition to the project. Caleb Flora, the applicant's representative, and Catherine Borges, a resident of Salida and former Salida MAC member and Stanislaus County Planning Commissioner, spoke in support of the project. The Planning Commission recommended that the Board of Supervisors approve the project as outlined in the October 21st, 2021 Planning Commission staff report, included as attachment 1 of the board report on a vote of 7-0. To conclude, the Planning Commission recommended that the Board of Supervisors approve the project as proposed in the October 21st, 2021 Planning Commission staff report, including all of the findings of Exhibit A, including findings regarding environmental review, rezone, road improvements, agricultural buffer, project approval, and adoption of an ordinance. That concludes my presentation, and I am available to answer any questions. Thank you.
So the original map, is anyone surprised that that's A2 zone, that 10 acres? That's stunning to me. If you go back to that original. So is it only the parcel there to the north that's green that's an A2 zone, right? The skinny one? Mm-hmm. That's not owned by Blue Diamond, or I should look, it's not. Okay. No. And is that where the only ag buffer has to go?
Yes, correct.
And what are you talking about as far as making an alternate ag buffer? Since it can't meet the setback, this is a fence with some plants or something?
It's very minimal. We recognize that there really is no long-term ag production there. We're just following guidelines that require it.
Okay. I was just going to suggest that it's not too intrusive because the other parcel will. It's just a matter of time. But I didn't realize it until I read the staff report. And so, all right. Any questions of staff before I open up the public hearing?
Just real quick, just to reinforce, this was supported by the MAC back when it happened. And I'm just curious, how long from start to finish did this process take for Blue Diamond to, when they first put in the application for this? Do you have any idea?
This project, if you just look at the project date, the application number, it was in our office for quite some time, but it was on hold mutually as Blue Diamond was working through some of their plans and as some of the health assessments were done. So at no time was any of their development out there ever held up. It just took a while for this project to go through, and it was a very unusual timing for this type of project.
So not a good one to look at to say how long it took because it was mutually stuff going on with them.
Correct. Okay. This would not be a good one to.
Perfect. Very good. All right. Thank you, guys.
Thank you. Any other questions of staff? No. I'm going to open up the public hearing. Anyone who wants to speak, come forward.
Just a quick one. I wanted to follow up on Brad Johnson's concerns. She said that staff thought that they had alleviated those, or at least, I won't put words in her mouth. He had concerns about sound, about dust, and that sort of thing. I want to know what was done to his complaints that made him go away, so to speak.
Okay.
Thank you.
We took a look at all of his comments that he had made. We went back and looked at the project, how it was designed, the results of the traffic assessment, of the air quality assessment, and we believe that through the conditions of approval that the project, and through its operational standards, that the project will not create any impacts. At the Planning Commission, Catherine Borges, who is also a resident of Salida, spoke. And she addressed those concerns that Mr. Johnson had raised, and she brought some counterpoints to those as a resident, that there had never been any issues with air quality or traffic associated with the facility. So we believe that it's been fully covered and that those impacts are not going to be there with this project.
Thank you.
Good morning.
Good morning.
My name is Mallory Hayes. I'm with Blue Diamond Growers. I am the Government and Public Affairs Manager. I just wanted to say a brief few words. First of all, thank you for having us today and for hearing our application. And thank you both for all the great work you've done. Blue Diamond has been a proud community member for over 50 years. We employ over 800 team members here in Stanislaus County between our two facilities in Turlock and Salida. And we support over 3,000 almond growers up and down the Central Valley, but many of whom are Stanislaus County residents. And as a cooperative, we pride ourselves on our commitment to our community, sustainability, and to delivering the benefits of almonds to the world. Now, this rezoning is critical to Blue Diamond's continued growth and prosperity. As you know, it allows for a more streamlined process for both Blue Diamond and the county, while also ensuring due diligence is taking place through our continued work with staff and the necessary agencies. Ultimately, this will allow for Blue Diamond to continue what we do best, which is investing in our community, taking care of our team members, providing a robust return to our grower owners, and delivering the benefits of almonds to the world. So with that, I ask for your support and thank you. We look forward to our continued partnership in the future.
Thank you, Mallory.
Thank you very much.
Anyone else? Okay. Seeing none, I'm going to close the public hearing and bring it back to the board.
I will make a motion to approve staff recommendations.
Second.
We have a motion and a second. Can I ask one more question? That just, if you're allowed to put a processing facility, obviously out in the unincorporated area, you have to do a use permit, but you could put a processing facility ag. Did this need to be rezoned? I guess it is to plan development, right?
You can do a processing facility with certain limitations in terms of the number of employees and the product size, so this would exceed that.
Okay, got it. Okay, we have a motion and a second. All those in favor say aye.
Aye.
Opposed? Carries 5-0. Thank you, guys. All right, move on to, I'm flipping my page. Public hearing number 3, hearing to consider approval of substantial amendment number 1 to the Stanislaus Urban County's fiscal 2021-22 annual action plan. And we do not have any public comment or written comment on this, Liz, correct? Okay, that is correct.
Good morning again, Angela Freitas, County Planning Director. Stanislaus County serves as the lead entity for the Stanislaus Urban County, which is comprised of various members, including the city of Ceres, Houston, Newman, Oakdale, Patterson, Riverbank, and Waterford, and we come together as an urban county for the purposes of receiving U.S. Housing and Urban Development, Community Development Block Grant, and Emergency Solutions Grants funding. An annual action plan is a plan for projects and actions to be taken during the specific fiscal year. The fiscal year 2021-2022 annual action plan is year 2 of the Stanislaus Urban County's 5-year consolidated plan, which runs from 2020 to 2025. A substantial amendment is triggered with the addition of a new activity, and when a proposed amendment involves a reallocation of over $160,000 in funding. The City of Waterford is requesting to cancel their Main Street infrastructure project and to add an H and I Street infrastructure project. Construction of the Main Street project has already been completed and used general fund dollars for that. The HUD required environmental review had not been finalized prior to construction, which made use of the HUD funding ineligible, so they are just wanting to change their projects. The estimated construction cost for the Main Street project was $250,000. The estimated cost for H and I Street is $600,000. In total, the City of Waterford has $710,000 in CDBG funds that have been allocated over the prior years. If they don't spend it, it rolls over along with any administrative funding and if they have any program income. In accordance with federal regulations and the Stanislaus Urban County Citizen Participation Plan, the substantial amendment process requires a 30-day public comment period. which was open between November 3rd and December 3rd. Notices of this public hearing, along with the document availability, were published in the Modesto V and the Waterford News, and then it requires that we hold this public hearing here today to consider this item. Staff is recommending that this board approve substantial amendment number 1 to the Stanislaus Urban County's fiscal year 21, that should be 21-22 annual action plan, to authorize the planning director to take all necessary actions to implement the substantial amendment, and to authorize the planning department to incorporate any comments that we might receive here today into the final document, and to make any technical alterations as directed by HUD. And with that, that concludes my report. If there's any questions, happy to answer them.
This seems pretty straightforward. I will ask, how long can they carry the money? It keeps accumulating, but there's a piece taken out of it for administration, right? So
in total, our CDBG funding has to be spent within 7 years of having been received, and as the urban county, we are required to meet timeliness, so we does need to roll over, and then moving to a more expensive project is actually a really good thing for timeliness.
I was going to say using general fund money to complete a project is fantastic and better to get the big ones. Any thoughts or comments from the district? Any questions? All right, I'm going to open up the public hearing. And I'm going to close the public hearing and bring it back to the board.
Motion to approve staff recommendation.
Second. We have a motion and a second. All those in favor say aye.
Aye.
Opposed? Motion carries unanimously. Thank you very much.
Thank you very much.
We do not have any discussion items. We're going to move on to item 9, correspondence.
This board has received a notice of intent to adopt a groundwater sustainability plan from the Tuolumne County Groundwater Sustainability Agency for the Modesto Subbasin.
We refer to the Department of Environmental Resources.
This board has received the claims as noted on the agenda.
Acknowledge receipt of claims and refer to the Chief Executive Office. Are there any Board of Supervisor reports? I guess I would quickly report out that 4 of the members, Supervisor Buck Condit, Supervisor Manny Graywall, Supervisor Terry Withrow, and myself attended the California State Association of Counties, and it was their annual meeting over in Monterey. It's a great opportunity to learn, especially for the new members. As you may or may not know, I was president of the association and previously, but if you're working on any state legislation, any federal legislation going through the state association is the way to go. Many breakout sessions and attended by, maybe there were about, if there's 290 supervisors, probably 125 of them there, had to prove vaccination status. So it probably kept some people out, but exciting times, and I learned absolutely a lot. So I just wanted to report that out. And move on to item 11, legislative fiscal management report.
Nothing to report today.
Okay, we do have an announcement. Item 12, the Stanislaus County Board of Supervisors workshop will be held this Thursday, December 9th at 9 a.m. at the United Samaritans Foundation Community Center. It's not at United Samaritans, on the corner of Fox and Euclid, but this is on 3rd Street, 2413 3rd Street in Houston, which is right across from the library there in Houston. And said that you were going to be announcing this. And the time is from 9 a.m. until we're completed. I think we're done by 3 a.m. or 3 p.m. And we do have a closed session.
Yes, we have closed session today. We have 3 items. The first item is the public employee appointment with respect to the reappointment of the Chief Executive Officer, and that's pursuant to Government Code Section 54957, Subdivision B. We have the second item is a conference with legal counsel, existing litigation pursuant to Government Code Section 54956.9, Subdivision D1. We have 2 cases to consider there. Alvin Estrada versus County of Stanislaus et al., and that's Superior Court case number CV 1900153, and the MDL 2804 opiate litigation that's in the U.S. District Court. ND, what is ND? Northern District, there we go, of Ohio, and the case number is 17MD2804. Man, sometimes the brain doesn't work, right? And then the third item is the conference with legal counsel, significant exposure to litigation pursuant to Government Code Section 54956.9, subdivision D2 or 3, and we have one matter there. That's with respect to the Voting Rights Act, potential liability. And with that, appropriate for public comment.
Any public comment on these issues? Last comment, Stephen again. And Emerson, thank you for sticking around the whole time. And we do appreciate it. And that's Deputy Carter, who yesterday was his first day. He's been hanging out with us. Appreciate you taking the time. And we're going to adjourn to closed session.